Welcome to the deep dive.
Great to be here.
Today we're tackling a subject that, well, it kind of blends martial arts lore with the hard science of the human body. We're talking Kyusho.
Pressure point fighting, basically.
Exactly. And we've got a really fascinating source for this, The Secrets of Kyusho pressure point fighting.
Right. The one by Reinisch, Holler, and Malushka. A mix of backgrounds there.
Yeah, a jujitsu guy, an athletic trainer, a business coach.
Hmm.
All martial artists. And what's really interesting is the acknowledgments. They thank medical professionals, doctors, which sort of hints that this isn't just about legends. There's some real anatomy behind it.
Absolutely. And that's kind of the point, I think. When you get into the book, it really tries to move past the, let's say, the more mythical stuff.
Like the touch of death.
Exactly. Forget the movie stuff. The aim here for us today is to explore what the book actually lays out the anatomical reasons, the physiological explanations for why these points are vulnerable.
Right. So for everyone listening, think of this as us kind of guiding you through the book's perspective on the body's weak spots.
According to these experts, yeah.
We'll look at the principles, drill down into specific examples.
And discuss the potential effects.
Yeah.
You know, from just pain to something more serious.
But always keeping it within the context the book sets out self-defense, martial arts.
Definitely. And we absolutely have to mention the warning.
Oh, yeah. Crucial. The book itself is very clear. This stuff can be dangerous.
Extremely. They stress qualified supervision for any kind of practice.
So this deep dive, it's purely informational. We're just exploring the ideas in the book.
An intellectual exercise. They also mention using male pronouns for simplicity, but it applies to everyone.
Good point. Okay, mission understood. Let's dive in. Where better to start than the head?
Makes sense. It's amazing how many sensitive spots are packed in such a small area. The book kicks off with the eyes.
Which is intuitive, right? We all know eyes are vulnerable.
For sure. And the book details some pretty serious potential outcomes from strikes or pressure.
Like what?
Well, contusions, obviously, but also a dangerous increase in eye pressure.
Yeah.
Even retinal detachment or optic nerve damage.
Wow. And there's that reflex they mentioned, the oculocardiac reflex.
Yeah. That's fascinating stuff. The idea that pressure on the optic nerve can actually trigger a nervous system response,
Leading to a slowed heart rate.
or even in extreme cases, unconsciousness or cardiac arrest, it really shows how connected everything is.
It really does. Plus, instinctively, we protect our eyes.
Always. So even a feint towards the eyes can create an opening elsewhere.
The book even mentions a variation with the stranglehold, using the thumbs on the eyes.
Ugh. Yeah, it shows how these points can be used to set up other things or control someone. Moving down a bit, there's the chin.
The protuberancia mentalis.
That's the one, the bony bit.
Yeah.
But it's not really presented as a knockout spot.
For pain.
Exactly. Pressure there, maybe with a thumb joint, hits the periosteum, that sensitive bone covering.
Yeah.
It hurts a lot.
So it's more of a freeing technique. Create a distraction.
Yeah, make someone flinch, maybe loosen their grip. Similar idea for the corners of the mouth.
Hooking a finger in and pulling outwards.
Right. Again, mainly pain. Good for escaping a scarf hold, apparently. But the book warns you might get bitten. Teeth are sharp.
Yeah,
Yeah.
very practical consideration in a real scramble.
Okay.
What about the nose?
A nose. Osnasal. The book goes into quite a bit of detail. Says it's pretty delicate.
Easy to break.
Apparently. Even light strikes can fracture it. And that causes intense pain because of the nerves inside the nervi ethmoidales.
So watery eyes, bleeding.
Right. Bleeding that could block airways, and even the cartilage part, the septum, can slip out of place, a subluxation.
And they mentioned that old legend, right? Pushing the bone into the brain.
They do, but they clearly label it a legend, thank goodness.
Yeah.
I mean, realistically, a broken nose is bad enough. Pain, can't breathe properly.
Definitely. And they show techniques like a scissor grip on the nose.
Not just striking, but using it for control. Maybe combined with bending the back or neck manipulation.
Okay. And related to that, there's the spot right under the nose.
The subnasal point, that little groove. High concentration of pain receptors there.
So a strike could cut the lip, knock out teeth.
Or even fracture the upper jaw. And again, blood, teeth, airway obstruction risk. Serious stuff.
Let's shift to the sides of the head. What about behind the ears?
The great auricular nerve. Nervus auricularis magnus, just behind the earlobes. Pressure there causes nerve pain. Neuralgia, they call it.
And below the cheekbone?
That's the buccal nerve. Nervus papalis. A scissor grip or a knuckle strike there. Same thing. Neuralgia.
It's amazing how localized pressure on these nerves can be so effective.
It really highlights the need for precision, doesn't it? It's not just flailing. Like the forehead nerve, nervus frontalis,
Or is that vulnerable?
along the eyebrow ridge, top of the eye socket. Pressure or a strike causes that nerve pain again.
But they warn about being careful near the eyes.
Absolutely. Need extreme caution. Maybe stabilize the head with the other hand to avoid accidental eye injury.
Makes sense. Safety first, even when discussing attacks. Okay, lower down. Below the eyes.
Informal nerve. Upper jaw area. Sensitive, connected to the upper lip and teeth.
And the chin area again.
The mental nerve. Punch or pressure causes pain and, crucially, might force the jaw open.
Creating an opening for something else.
Exactly. A tactical point. Even the upper lip itself.
How so?
A scissor grip affects the muscle around the mouth, orbicularis oris, and also hits that infraorbital nerve zone. Again, they suggest using the other hand to counterbalance.
Got it. Now, the ear. That seems like it would be more than just painful.
Oh, definitely. The book talks about a cupped hand slap causing air compression, barotrauma.
Which can rupture the eardrum.
It can, yeah. Painful, hearing loss, risk of infection. Plus, the ear is full of nerves, even branches of the vagus nerve.
So even a light touch inside could cause pain, nausea.
Potentially. And don't forget balance. The inner ear is key for equilibrium. Mess with that, you get dizziness.
And that reflex when something goes in your ear.
Exactly. An involuntary jerk away. Also near the ear, there's the parotid gland.
The salivary gland.
Right, in front and below. Pressure or a knuckle punch there can hurt the muscles, nerves, maybe even damage the gland or jaw.
Okay, now for the really heavy stuff. Skull injuries.
Yeah, the book gets serious here. Discusses different fracture types, basal, facial, cranium, and TDI, traumatic brain injury.
Graded by unconsciousness time symptoms.
Right. Headaches, dizziness, pupil size difference, memory lapses, nausea, all the way up to paralysis, coma. It takes serious force, obviously.
Requires skill or just a huge amount of power.
And related is the temporal bone, side of the head, temple area.
Why is that so bad?
It's thin, protects delicate inner ear and brain structures. Plus, a major artery runs underneath the middle meningeal artery.
So a blow there risks arterial bleeding.
Which can be fatal.
Right.
Very dangerous spot. There's a specific weak point called the metapterion, where skull bones meet.
Back to the front, the forehead humps. Tubera frontalia.
Repeated knuckle strikes there cause pain-sensitive periosteum and nerves. A massive blow risks concussion.
Okay, lower jaw. What are the risks beyond a broken jaw?
Well, minor lip-tongue damage is one thing. But dislocation or fracture, especially if the mouth's open, is serious. Nerve damage affecting chewing is possible too.
And whiplash from an uppercut.
Yeah. And airway blockage if it's a really bad break. Plus the book notes you could hurt your own hand on their teeth.
Good point. Man, the head is just packed with targets. Anything else?
Quick ones. Submandibular gland at the jaw angle, sensitive nerves. Lower lip pressed against teeth pain, but maybe limited use. Sublingual gland under the tongue, same deal. Sensitive but niche.
Cheeks.
Pincer grip can cause pain, open the jaw. Like getting a dog to drop something, the book jokes. And the tooth sockets, dental alveoli jabs or knuckle strikes for pain-freeing techniques.
Right. That covers the head pretty thoroughly. Let's move down to the neck.
Okay, the neck.
Hmm.
Another area with some extremely vulnerable targets. The carotid artery is a big one.
On the sides of the windpipe.
Exactly. Pressure or a strike there can trigger a reflex, blood pressure spikes. Vessels dilate, especially in the gut.
Leading to fainting. Lack of blood to the brain.
Potentially, yeah. Unconsciousness. Often reversible if they're laid flat, blood flow returns. But the dangers are huge.
Like.
Slowed heart rate, weakened pulse, breathing can slow or even stop. And the risk of heart attack or stroke if plaque gets dislodged, it's serious.
The book really emphasizes the danger and ethical issues, especially for training.
Absolutely. This is not something to play around with.
Yeah.
Then there's the back of the neck, the cervical spine.
Neck levers, strikes.
Can affect the nerves coming out of the spine, the brachial plexus, leading to problems in the neck, arms, diaphragm, chest, back.
Wow, even bladder bell control and sexual function.
According to the book, potentially. Plus, risk to the vertebral arteries supplying the brain. Spinal cord lesions, numbness, paralysis, and of course, whiplash.
Headache, dizziness, vision problems.
Yeah. Okay. Front of the neck, that little dip.
The jugular notch, fossa jugularis. Pressure or a jab there irritates the windpipe. Can bring someone down quickly or break a hold.
That's the idea, yeah. Especially with head control. Then the big side muscle, sternocleidomastoid.
Pincer grip or hooking it causes muscle pain.
Right. You got to be careful of the carotid nearby. A blow there can also disorient via stretch reflex, maybe injure the spine,
And where it attaches near the skull.
that hollow point. Thumb pressure causes nerve pain. Dizziness is possible from carotid pressure or windpipe irritation too. But maybe the most vulnerable spot, the larynx, voice box area.
Larynx membrana. Yeah, the book calls it out as having no real natural protection.
So strikes or grips can cause collapse, suffocation risk.
Huge risk. Vocal cord spasms, epiglottis swelling, problems breathing or speaking if the hyoid bone breaks. Almost as bad as the eyes, the book says. Wow. What about below the collarbone?
Clavicle hollow. Thumb pressure inwards and downwards targets the cervical plexus, scalene muscles. Nerve pain again.
And the traps. The big neck shoulder muscle.
Trapezius. Strikes or pincer grip cause muscle pain, but also risk concussion via stretch reflex at the skull base. Whiplash possible too.
Okay, neck covered. That's a lot of critical spots in a small zone. Let's move down to the torso.
Right. The torso, a different landscape nerves, organs, starting with the armpit, the axilla.
Nerves there from the brachial plexus.
Extensions of it, yeah. So a kick or finger jab can cause significant nerve pain, neuralgia, but it's usually not easy to get to.
Center of the chest, breastbone.
Sternum. Strikes knuckles, headbutt, knee, fist base cause pain, coughing. But also fractures, fainting, breathing issues.
And even heart issues, like cardiac arrest.
Potentially. The book mentions commotio cordis, that rare thing where even a light blow at the exact wrong time of the heart cycle can stop it, especially in younger people.
Scary. What about the chest muscles themselves? Pecs.
Gripping the armpit to affect the pectoralis major causes pain, but it's called relatively harmless. Harder on muscular folks or with thick clothes. Nipples are mentioned too, biting, pinching, but usually protected.
Okay, now the obvious one. Testicles.
Universally acknowledged vulnerability. Kick, punch, grip, excruciating pain via the genitofemoralis nerve.
And it's not just pain, is it? The book mentions other effects.
Right, the parasympathetic nervous system gets involved. Drop in blood pressure, slowed heart rate, slowed breathing, can lead to vomiting, unconsciousness, even cardiac arrest.
Plus internal bleeding, infertility risk, displacement. Yeah. Instinctively guarded for a reason.
Absolutely. Shifting to organs, the liver, upper right abdomen.
Vulnerable to rupture. Painful.
Very painful due to nerves in its outer capsule. Rupture risk from strong blows. Groin area also mentioned hernia risk, especially if there's a weakness. Usually it makes the opponent double over.
Creating an opening. Stomach.
Punches, picks. Effectiveness reduced by strong abs or thick clothing. Spleen, upper left abdomen.
Also rupture risk. Dangerous.
Yes, high risk of shock if it ruptures because it holds a lot of blood. Can be fatal if untreated. Shoulder muscles, deltoids.
Bruising, pain, limited mobility, maybe damaged shoulder joint, rotator cuff, axillary nerve. Less effective on very muscular people.
Kidneys, lower back, either side of the spine.
Renal trauma, contusion, rupture.
From strikes or kicks. Kids are higher risk. Symptoms are flank pain, maybe blood and urine, but not always. Also, grabbing the skin folds nearby can be painful, but harmless. Varies person to person.
Ribs. Protective cage, but vulnerable.
Severe pain, breathing problems, bruises, fractures from strikes, kicks, body scissors, especially floating ribs.
And fractures can damage other things.
Lungs, pneumothorax, contusion, intercostal muscles, diaphragm. Broken ribs can even injure the spleen or liver, clavicle, collarbone.
Breaks relatively easily from a direct blow. Risks damage to blood vessels, nerves like the brachial plexus pain, tingling, paralysis. Usually obvious if broken. Swelling, misalignment.
Yeah, makes the arm useless. Small risk of puncturing a lung too. Solar plexus, that nerve cluster in the upper abdomen.
Classic target. What does the book say happens?
Hard punch or kick stimulates digestive glands muscles, nausea, vomiting reflex. Can cause vasovagal syncope, fainting from blood vessel dilation, less blood to the brain.
Pain, can't breathe.
Right. Risk of internal organ rupture too. Liver, spleen, stomach, pancreas. More effective if they're breathing in.
Coccyx, tailbone.
Kick or hard fall can dislocate it. Very painful, hard to sit, long healing. Need to be behind them usually. Lower abdomen, bladder, intestines, pubic bone.
Punch, kick, knee strike, pain, internal injury risk.
Yeah. Bladder rupture risk, especially if full. Intestinal wall rupture from big impact, pubic symphysis injury, even violent bowel movement urge.
Okay, that's a lot for the torso. Let's move to the arms.
Right, arms. Often used for blocking, but they have weak spots too. Skin itself.
Pinching hurts. Free nerve endings.
Exactly. Effectiveness varies, but can be a freeing technique. Biceps.
Forceful blow causes pain, temporary immobility, bruising, maybe torn fibers.
Elbows are critical. Striking a straight elbow.
Dislocation risk. Severe joint capsule damage, often fractures too. Nerve damage, ulnar, radial causing paralysis, brachial artery damage, blurs the line with joint locks, the book says.
Yeah.
Pressure between the metacarpals or a knuckle strike. Pain used to break clinches. Wrist.
Pressure between tendons or a strike. Hits the superficial median nerve. Painful.
And fingernails.
Simple scratches can be very painful. Effective freeing technique may be less. Elegant. Specific nerves are targets too. Median nerve.
Near the biceps tendon. Pincer grip causes neuralgia. Effectiveness varies. Radial nerve.
Runs along upper and lower arm. Pressure or strike causes pain radiating to fingers. Need a precise angle for the upper arm target. Ulnar nerve.
The funny bone nerve. Inside elbow, lower arm. Strike or pressure causes intense pain, radiating to little knurring fingers. Classic target. Inside of the upper arm.
Punch causes nerve pain. Book mentions unlikely but severe risks like thrombosis, blood clots, pulmonary embolism, heart attack, stroke, limb damage. Scary potential, even if rare. Triceps tendon.
Back of the upper arm, near elbow. Pressure causes pain, might involve the ulnar nerve. Numbness in fingers could indicate damage. Okay, arm's done. Finally, the legs.
Legs. Big muscles, but still vulnerable. Achilles tendon.
Back of the ankle, stamping kick, shin pressure can tear it or cause pain. Ankle-foot injury risk if they're on their toes. Sensitivity varies. Instep.
Stamping kick can break it. Nerves between toes are also pain targets. Book jokes, high heels, might help strike low targets.
Yeah. Skin on the inside thigh.
Like the arm, pinch for pain. Varies in effect. Freeing technique, knee. Major target. Kicks to kneecap, risk slippage. Side, ligament meniscus injury. Hollow behind, patellar fracture risk. Pain, instability, shock. Hollow behind the knee, specifically popliteal fossa. Kick or pressure causes nerve pain, tibial nerve. Effectiveness varies, may be limited practical use. Sciatic nerve, largest nerve, back of thigh. Kick, especially shin knee when muscles relax, can cause paralysis or neuralgia, pain down the leg, numbness, weakness. Relatively easy target.
Outer thigh.
Kick causes muscle pain, bruising, vastus lateralis, tensor fasciae latae. Nerve thrombosis issues unlikely. Easy target, but less effective on muscular legs, inner thigh. Kick strike causes muscle pain, bruising, adductors. Potential for saphenous vein thrombosis, rare risk of pulmonary embolism, possible femoral nerve issues affecting movement, not as easy to target as the outer thigh.
Shin bone, tibia. Everyone knows that hurts.
Kick or sawing motion causes inflammation, even fracture. Fracture risks thrombosis embolism. Periosteum super sensitive, sharp initial pain. Open fracture is common because it's right under the skin. Sensitive spot just above the ankle too. Calves. Kick pressure causes pain. Risk of neuralgia affecting tibial, psoralis, peroneus, communis nerves. Thrombosis risk from trauma too. Need precision for pressure points. Strike at heel has bigger impact. Targeting just below knee, all sides, helps with leg throws imbalance, pain.
Fibula, the smaller leg bone?
Kick can break it.
Yeah.
Can't bear weight then? Easily reached, effective target. And the book wraps up with a mention of special techniques.
Right, like painful skin gripping says it works even on muscular people with few clothes.
But it also notes, realistically, that very thick clothing negates a lot of these pressure point techniques, leading to that sort of humorous line.
If you can't beat them.
Maybe try to make friends instead.
Wow. Okay, that was comprehensive. An absolutely staggering number of attack points detailed in that book.
It really is. And it hammers home the author's goal, providing the anatomical, the physiological reasons behind why these points work, or might work, moving beyond just pain, paralysis, death.
Definitely. So for you listening, what are the key takeaways here?
I'd say first, the absolute importance of knowing anatomy if you're looking into Kyusho. Second, the sheer range of effects from just making someone flinch to causing life-altering injuries.
And also how things like body type and clothing make a difference.
Huge difference. And that precision matters. Context matters. Especially when thinking about self-defense versus, say, controlled martial arts practice.
Right. So maybe a final thought to leave everyone with. Considering all these vulnerabilities we've just mapped out across the body, how does knowing about these pressure points change your perspective?
Yeah, your perspective on both the potential for harm and maybe the need for real skill and control if these techniques are ever applied.
And maybe just on personal safety awareness in general. Something to think about. We definitely recommend checking out the source if this sparked your interest.
For sure. There's a lot more detail in the book itself.
Well, thank you for joining us on this deep dive into the sometimes uncomfortable secrets of Kyusho.
Thanks for the discussion.